Oh, finally.
Now we're seeing
Okay.
Okay. Perfect. Okay. We have a camera. Do we have sound? Folks on Zoom, maybe Anita, if you could hear, could you let us know that you can hear us?
Yes, I can hear you.
Excellent. In that case, we will call this meeting to order and welcome everybody to the November 2023 Ward 6 NPA. My name is Dale Azaria. I am one of the Ward 6 NPA steering committees. We are a group of volunteers who help to organize these meetings. I am the only member of the steering committee who is here in person, but a couple of our other steering committee members are on the Zoom. Anita just said hello, and one of our other steering committee members, Mills Forney, is here as well. It would be great if we can start by just introducing ourselves so that we all know who's here in the room. Anybody who would prefer not to introduce themselves is welcome to pass, of course. But I think it's just nice if we know who we're sitting here with, both in the room and online. Maybe we can just kind of go down the table this way and then snake back around. If you wouldn't mind going first.
Good evening, I'm Michael LaChance, I'm the fire chief.
My name is Sarah Hernandez-Tim. I'm the Public Information Officer for the Burlington Police Department.
Judy Barber, resident, Robinson Parkway.
Brian Jarrett, Robinson Parkway.
How about if we go all the way up there to the front of the room?
I'm Scott Rogers, Community Development Manager with CETA.
I'm Fosca, I'm the new NPA Public Engagement Coordinator.
I'm Scott Hovick, Substance Use Policy Analyst for the city.
Victor Prusak, I'm here as a Ward 6 resident and for the Burlington School District.
Jim Brown, I'm a resident, I live on Clymer Street.
Ethan Fleming, I'm with the University of Vermont Student Government Association.
Charlotte Gillen, I'm a resident.
And over here,
Nick Anderson, I'm the AVP of Planning at Champlain College, so I'm your host tonight and can help if you've got any questions. Just quickly, sorry if I put the poster, for the reference, fire escape is straight that way or out this way, two different ways, or down the end of the hall and out. There's bathrooms right beside, just outside the door here, and yeah, feel free to ask if you've got other questions about where the things are in the facility.
and Charlie, I don't know if you want to introduce yourself from behind the camera.
Yeah, I'm Charlie G from Town Meeting Television. Thank you.
Excellent. And is there anybody online who would like to introduce themselves? I think that if you want to speak, do they need to change from being a panelist, or can they just be called on? Oh, Alan.
Yeah, I'm Alan Matson, Ward 6 resident. Sorry, not in person, not feeling too well tonight.
And my husband also, but he didn't feel like saying that it was in any official capacity. Connie.
Hi, I'm Connie Crosney. I can't seem to get a video to work, so I don't know whether we're doing that or not. I live in Ward 6, and I'm glad to be here.
Thanks, Connie. We had a couple more people walk into the room. Oh, well, first we'll stay online for a second. Rebecca.
I'm Becky Lavasser. I'm a Ward 6 resident.
Nice to have you. And we had a couple more folks walk into the room. If you don't mind introducing yourselves.
I'm Henry Severance, Ward 6 resident. Jack Evans, also Ward 6.
Terrific to have folks here. Thank you very much. So we start these meetings with any public comments or announcements that folks would like to make. You're welcome to share your news, your events, your questions, and your concerns.
Great. Well, I would like to extend an invitation to each of you to the Burlington Police Department's Community Academy. The Community Academy is a hands-on opportunity to learn about BPD and interact with our officers and staff. The Community Academy is open to those 18 years or older and those who live in or work in Burlington. It will take place every Wednesday evening from 6 to 9 p.m. starting January 3rd through February 7th at the Burlington Police Department in our community room on 1 North Avenue. Applications are due by December 15th, and I have brought with me flyers today with additional information here, and I also have provided these to our steering committee members as well.
And we can link to a copy of this information in our notes from today's meeting to make it available, but also for those who didn't get a paper copy of this and would like, there's a couple more sitting on the table over there where nobody is sitting, so please feel free to grab one if you're interested. Any other public comments or announcements? From anybody online? Okay, Bosca, were you able to bring those survey questions? So, one thing that we as the steering committee always want to know is, what people would like to get out of these meetings. Clearly tonight we've got an important topic, and sometimes those topics are sort of obvious. Sometimes people contact us and say that they have something that they'd like to present, and those can be folks who work for the city or folks who represent us, or whoever it is. So we sometimes get requests from people who would like to present to the Ward 6 NPA, but we would really like to know what, if anything, folks would like to hear about and how folks would like to use this meeting time. So we put together this short little questionnaire that anybody is welcome to fill out. If anybody didn't come with pen or pencil, because these days we just use our laptops and our phones and whatever else, I do have a pen that I am happy to share. And maybe Nick is over there digging for extra because he's got everything that anyone would ever need to hold a meeting. If anybody's got any suggestions that they want to offer up out loud, that would also be terrific.
Do you want to tell the people online they can access your Google form on the agenda?
And I will tell the people online that they can access the Google form that asks a very similar set of questions on the agenda. Alan, you've got your answer. Thanks for asking. And yeah, you can access it on the agenda and probably wherever you found this Zoom link, you can probably find it there too. I thought I emailed it to you, I'm sorry. If we are done with announcements in public forum, we just have a single agenda item for tonight, and it's clearly one that has stirred up a lot of interest based on the fact that we've got a bunch of people here, which is always great. As we read in the papers, the Burlington City Council declared that the drug crisis is a major public health issue and is initiating efforts to address that. And we invited folks from the city council, from the police department, from the fire department, from the school district, and from CEDO, the city's substance abuse policy analyst, thank you, to give us an idea of what this means, what's happening, what we should know, and what we can do. We had a feeling that there'd be a lot of questions. I should add that Police Chief John Murad let me know that he will be here as soon as he can. He's got to take care of his kids and expected that he would be able to get here at about 7:15. So we'll be able to hear from him then, and maybe in the meantime, you can keep track of questions and relay them to him when he gets here or after, or maybe there's things that you know about and can answer. Joan Shannon, one of our city council representatives, let me know that she was not going to be able to make this evening's meeting. She has a Mills, welcome, come on in.
Hello.
Joan has a conflicting city council ordinance meeting tonight, so she's not able to be here. We're expecting Karen Paul, so hopefully she'll get here at any moment. But in the meantime, would love to hear from Chief LaChance and from Scott Paddock and from the school district to perhaps get us started. And we don't have a particular order here. What we asked the participants to do was just make some introductory comments, let us know what they thought was important, and then pretty quickly move to questions and discussion. Because that's what so often we don't get a chance to do. We can read the news, but we don't often get a chance to interact with the folks who are implementing these policies.
Yeah.
Would you be willing to kick us off?
Sure, I did create a little presentation. I'm unable to connect to the Zoom, but I did email it to you. And
Okay,
maybe if you can connect it. to
so
the,
would I be able to share my screen?
Could be able.
Yeah.
Okay, let me get this open then. Maybe you can just start.
Okay.
Little,
That's
I will
okay.
get it up as soon as I can.
So as I introduce myself, my name is Michael LaChance. I'm the fire chief of Burlington Fire Department. And as you guys have seen in the news recently, we have implemented a new service in the city. We're in our third week now. It's the community response team, and it is two firefighter EMTs in a city vehicle, a city pickup truck, or a fire department pickup truck, kind of going around, and they're running unresponsives. Anything that comes in with unresponsive or overdose, they are taking that run, and they're also doing community outreach and community engagement activities as well. So they're not just responding to emergencies; they're also in the field working with folks directly and working to try to find solutions for them where they are. So we are connecting with partners like the Turning Point Center, our police department, CSLs are an excellent resource for us. The Community Health Center, just all these different agencies, we go out, we make contact, and based on needs, we just try to find solutions for folks. We are, again, responding to calls for unresponsive folks. Every unresponsive person is not an overdose. We had one day back about a month ago, we had 50 some unresponsive folks. 8 of them were overdoses. The rest were people feeling the effect of their drug, or they were sleeping maybe, or they were just not in crisis. So this team is actually going out, and they are able to run these calls if there is a crisis, if they are overdosed, or if they do have any kind of medical emergency. This team are all advanced providers. They do have defibrillators, they have Narcan, they have everything that they need to begin care if they need to. But they are basically able to be out there, get to the patients really quickly and assess. And if the person doesn't need services beyond that assessment, we are reducing unit movements for the fire trucks and the ambulances, allowing them to be in service for more acute emergencies. So this, you mind if I just,
Go right ahead.
thank you very much.
Right now.
It is. That's not the first slide.
That was,
That was the
that's the
first one.
first
Okay.
slide, and that's one.
There we go.
And then that's
All right.
what's next.
So this PowerPoint presentation is actually just an update. I updated it as of the 31st of October. This first slide just shows total responses for the fire department. As you can see, we already surpassed totals from 2021. We're creeping up on totals from 22, and we're looking at a one-year total response increase of 14%. These slides are interesting. Overdose totals transported versus non-transported. And as you can see, the blue is overdoses or total overdoses. The orange is the folks that we transport, and the gray is folks that we don't transport. And you can see that that increase year to year. Some folks wonder, why do we not transport people if they are overdose? Well, some of those folks are the overdose is converted before we get there. Some of them we convert that overdose with Narcan, but the patients, after you give them Narcan, are alert and oriented. So if they don't desire to go to the hospital, we can't kidnap them to bring them. So they don't go. So as you can see, there is a bit of an uptick in folks that choose not to go, but quite a few still do. And you can just see that monthly overdose responses average. And if you could see last month's, it's actually gone down. One thing that I noted today running numbers is the month of October had the fewest overdoses that we saw since September of 2022. So that's encouraging for sure. So you can see that monthly overdose chart, and you can see how September was really high, and then October dropped off pretty considerably. So that, again, it's 1 month, it's not a trend, but it is encouraging. So again, those calls for the dispatches of unknown problem or person down, that's where that CRT is coming in. And you can see those call numbers have been pretty steady over the years, and then in the last couple of years have gone up pretty considerably. That 510 is what's the expected for this year. And then some folks are like, well, how much of this is alcohol? And as you can see, the alcohol intoxication calls for that call type are pretty steady. I mean, they're not what's causing our increase. The homeless, houseless, transient, and no address population. This is a population that I'm focusing on a little bit, just to see where are we with these folks. They are a high risk population. Of course, now that it's getting colder out, they're higher risk. The city is working to stand up a warming shelter, I believe, beginning in December. So that's encouraging. But you can see that 2022 and 2023, we're seeing pretty significant increases. On the chart below, you can see that light blue, that's 2023. So it's pretty consistent month over month increases over the last number of years prior to. And again, it's just another way of looking at it. It did go down a little bit in the month of October, but it's still, as you can see here, fairly steady increase over previous years. And a lot of these patients are high-risk patients. They do suffer from substance abuse or mental health issues. And if we are dealing with these folks in the public, they are folks that sometimes just don't really want to work with us. So it's kind of one of those, we keep trying, they keep saying no, and then we just hope that we are able to reach them where they are. This is responses to overdose throughout the city. And as you can see, there are areas that are definitely a higher density, City Hall Park, things like that. But it is an issue throughout the city. And this is overdose responses hour by day and day of week. And again, it's mostly midday or those really heavy midday to evening, but it's Sunday through Saturday, pretty consistently. So that's it. That's my little presentation. I think I've spoken long enough. I'm happy to answer any questions.
I'm gonna suggest if anybody has any really specific questions about the data that you just presented, that would be fine. Otherwise, I'd like to go through all of the introductory remarks so that then questions can be directed to not just one person, but to the whole group. But if anybody's got a real specific question about what was just presented. Not seeing anybody.
That was thorough, thank you.
And just to introduce the last person to walk
Oh,
into
yes.
the room, what's that?
Yeah, thank you very much. I'm Mills Forney. I'm also a member of the steering committee. Apologies for being late. I have two very young kids and that time was a struggle. But I'm glad to be here.
Welcome.
I had a specific thing about, you mentioned there was a decline in October.
Yeah.
Do you have any, like, is there like an explanation?
No.
No.
Honestly, there isn't an explanation, and here it is the 1st of November, so if there was an explanation, I probably wouldn't know it.
Yeah.
All I did was draw that data out of our EMS reporting software and saw raw numbers, honestly, about 2 hours before this meeting. So regarding reasons, I'd like to dig into it more and see reasons. I think I did send the data to the mayor's office and the police chief, you know, and maybe he is seeing some things in the street too that we can collaborate on and say, hey, we're noticing this. And he shared his data with me, and his data showed the same thing, a drop off in the month of October. So it was a consistent, both departments saw that, and hopefully, at future maybe ComStat meetings, or we can grab that and say, what was the change?
Yeah, just go ahead.
Question, are there only 2 EMTs from your department available for this new initiative?
No, we're staffing this initiative with voluntary overtime. So we were able to stand it up in about 3.5 weeks. And the only reason we could do that is because we didn't have to hire for it, because we had overtime and we didn't have to buy, we used a vehicle we already had. It's our plow vehicle, so if it snows, it'll be a trick, but
If it snows, you said.
But I have, we've had about 15, maybe 18 of our folks sign up for staffing it, so it's a pretty broad section of people, everything from advanced EMTs to paramedics, so.
Scott, I wonder if you'd like to chime in at this point, let us know what it is that you're doing and seeing.
Sure.
Just help us get started with this conversation.
Yeah, I mean, I don't have much data for usually the data I present to the city involves Chief LaChance's data. So I can tell you who I am. Scott Boddick, Substance Use Policy Analyst for the city of Burlington. Been in this role for about 2 years or so. I also represent Burlington on the Opioid Settlement Advisory Committee. Happy to talk about spending recommendations or allocations made thus far if that comes up later in the meeting. I also represent the city on the state's Substance Misuse Prevention Council, so kind of both ends of the spectrum when thinking about prevention to recovery. Other than that, a lot of my work is standing up the mayor's monthly ComStat forums that bring together local stakeholders to discuss trends, data, observations that ought to be used to inform either community programming here in Burlington or advocacy for policy changes at the state level. Aside from that, I'm responsible for anything drug related in the city, or anytime anyone has a question about drugs. So
Here's nice.
oh yeah, and yeah, so I'm not busy, and yeah, it's a lot of work thinking about some of the things that we're tackling here for ad hoc projects, looking at bringing a community syringe redemption pilot here to Burlington for a few days to deal with the problem of improperly discarded syringes that have been just exploding around the city for the past few years, and looking at methadone expansion, access to treatment in partnership with the Howard Center's Shedman Clinic. So those are 2 efforts that I would hope you would hear more about in the coming months. Can't say too much specific wise yet, but was excited to at least be able to speak the words here tonight that those efforts are underway. But that's it for my intro.
Thank you.
Cool.
How about if we keep going around?
Sure.
Victor?
Yeah.
I am Victor Prusak. I'm the coordinator of the Office of Engagement for the district. Happen to live down the street. So Tom Flanagan asked me to attend tonight. Don't have a presentation like chief.
That's fine, we did.
No,
ask
no,
for
no, I know.
presentation.
Just kidding. That was actually great to see.
Just get extra credit.
Try to remove that.
Yeah.
Is that helpful? Okay. From the school district perspective, you know, it's interesting. School districts usually, when we're talking about drugs, we're talking about drug use among our students. That, I mean, that's always a concern, but that is not our concern at all. What we're seeing, particularly, actually, almost all of our school sites, but particularly at our schools in the Old North End, downtown, Edmonds Elementary, Edmonds Middle School, and our high school, of course, on Cherry Street. We are seeing and dealing with the impacts of the increased drug usage. What that looks like are needles everywhere, kids being harassed, kids feeling uncomfortable on their way to and from school, particularly in any sort of alcoves of commercial type buildings or Memorial Auditorium, the walkway in between the Cherry Street garage and the former Macy's. In the garage, though that's pretty rare during the day, but it's definitely creating anxiety among our students. We've seen a decrease in bike thefts. I'm not sure what that's about, if that's true across the city. I have noticed that a lot of our high school kids are using really crappy locks, and I'm shocked that their bikes aren't getting stolen, because in 2021, all of those were stolen immediately. So yeah, I mean, that's the big issue for us, and why we were happy to engage in this conversation today.
Thank you for being here. So just to catch everybody up, two of our other invited guests have shown up in the last couple of minutes, and we are glad to have you here. So you know what you missed. We heard from Chief LaChance with a lot of some information about their new program and some statistics about the increase year over year, as well as surprising and perhaps still unexplained decrease in October in the calls that they were getting. We heard from Scott Abbott about what he's doing and a couple of programs that he's excited will be starting soon. I think you both heard most of what Victor had to say about what's going on in the schools. And with that, and without further ceremony, I want to invite, maybe just by order of arrival, Chief Murad, I'll ask you if you want to just give us a little bit of introductory context. And what we're doing is mostly holding questions, but expecting that most of the time will be for questions and discussion.
Gotcha.
But just want to hear what you think is important that we know to set the context for those questions.
Sure, absolutely. So I thank you very much for having me. I'm sorry that I was late. My daughter Katie is in the Christmas tree lighting show, the tree lighting show for that happens on the day after Thanksgiving, and so she's in rehearsal for that. And I had to drop her off. And so I'm sorry I wasn't able to be here right on time. So, you know, obviously we're here because we're in a bit of a quandary with regard to public safety. We feel that public safety has slipped in the city. I think that folks feel that very keenly as they go about their daily lives in our city. We are, with regard to objective measures, particularly around violence, insofar as violence is an indication of safety, better than we were last year. We experienced a terrible, terrible spate in gunfire last year. We experienced a historic high for our city of murder. We had 5 in the year. We have never had that many. And we are not seeing that this year. We had one very terrible murder that was solved. We've had 10 gunfire incidents, and yet they are very different than the ones we saw last year. They are not following a pattern of involvement. And only 2 of them resulted in people being struck, which was very different than what we saw last year. Those are good things. 10 is still worse than we used to see. And so we are still working on that. I have deep concerns about where we may go with regard to that kind of violence based on the horrible incident that happened in Bristol. and the homicide of a young man, not a student in our schools here in Burlington, but someone that many youth in Burlington knew, and killed by a 14-year-old boy killed by another 14-year-old boy who was a student in our school system. I have great concerns about where that's going with regard to a sense of turmoil that is going on among groups of young people over this act, and some of the things that led to it. But insofar as our day-to-day and what everybody experiences in the downtown, it's primarily issues around the drug problem, which I'm certain that Chief LaChance was able to articulate, because they deal with it day in and day out, just as police officers do. And that is also driven by a vast increase in the number of homeless that are in the city. Homelessness in and of itself is not a crime, and many of the people who experience homelessness don't commit crimes. They do, however, often create a sense of public disorder, even if they're not actually creating behavior that is, by law, disorderly. And that's simply because people feel less comfortable when there's large numbers of folks who are unhoused out in the public sphere. That's just a fact of how we feel. We feel empathy and pity, but we also sometimes feel a certain amount of fear and a certain amount of concern for our own safety. And that kind of sensibility permeates everything that we do in our downtown and in our city core. So we are working on that. But the big issue when we talk about something like that, when we talk about a condition that is not unlawful, even if it can sometimes be a nexus for unlawful behavior, but it's a not unlawful condition that fills us with senses of lack of safety, how do we address something like that? Because we can't simply sweep folks off the streets. That's unlawful, it's immoral, it's not right, and frankly, we couldn't do it even if somehow that was the mandate that was given. We don't have enough officers, we don't have enough places to put folks. And that's a big issue. We don't have enough housing for these people who are living in ways that trouble us greatly. And that if you were to go to the encampments that I have been to, or that officers have to go to, that our community support liaisons and in-house social worker team that we've created to try to get at some of the factors that cause these conditions and help people out of these conditions, the places that they go to, you'd be astonished. It is not a way that any of us would want to live. So what are we going to do about that? It is not merely a public safety answer. In fact, public safety may be one of the least important components of addressing it, even though it is the most important component when we come to addressing the actual acts that create a sense of unsafety, whether that's crime or whether that's violence or whether that's disorder that teeters towards that. And I know that you want to make most of this about questions, so I'll sort of leave it at that. But we are in the midst of a huge question, a huge period of question. Yeah.
Thank you. Karen,
Yes.
would you like to say some introductory words? I know that this resolution that the city council adopted was important to you, and we would think what you have to say about it. And once we've done that, then we can open it up to a general discussion.
And I'll try to be brief about it. My apologies for not being here on time. I didn't have a dogger that was doing a tree run. But I had a legitimate excuse, just not probably as good as yours, Chief. So yes, we did on October 10th pass a resolution that had come through the Public Safety Committee. In addition to serving as the council's council president, I did an rather unprecedented thing and appointed myself chair of public safety, because actually there weren't a lot of people who wanted to be on the Public Safety Committee, because it is a very active one, and you can imagine why. The resolution that we passed was declaring the drug crisis an emergency and to be our top public safety and public health priority. For the first time as council president in a year and a half, for the first time I passed the gavel to be able to introduce this resolution and speak to it, because I felt that it was the most important resolution that we would pass all year. I think the chief has spoken to, and I'm sure that Chief LaChance has also spoken to the fact that this is a crisis of rather unprecedented proportion for a variety of reasons. And one of the things that Chief Murad spoke to is the number of people that are outside, although many of them are not people that are actively suffering from substance use disorder. There is a large number of people that are sleeping outside and have nowhere else to go. There's approximately, according to Sarah Russell, the Special Assistant to End Homelessness, it's around 200 people in Chittenden County, many of which are in and around Burlington. And each day they come out with a list of the number of rooms, motel rooms that are available by county. In Chittenden County, it is usually listed under the category of limited, which means less than 10 rooms are available for housing people that are struggling on the street. So it's a huge problem. Very soon, as we all know, it's getting colder outside. Very soon it will get much colder outside. And this is a serious problem. As far as the drug crisis goes, what we determined and what we put into the resolution, we'll set up community forums where people will come and talk and hear from people about harm reduction. We will have the Chittenden County State's Attorney who will also be there, people from the schools, from law enforcement, to sort of learn about where we are with the drug crisis, and then to offer ideas and suggestions on how we can improve the situation that we have in our city. A lot of people very much want to talk about public safety, and this is going to be an opportunity for all of us to get together and talk about public safety. It's going to be the 13th and 14th of December. We have the locations, but haven't confirmed the second location, so I can't put those out there quite yet. But I think that what I've heard from most people that I've spoken with is that there's no question that those who are suffering, that people in this community who see those that are suffering from substance use disorder, they want the people that are struggling to get well and to be safe. We all want to be safe, and I think that is the really crux of the issue, is that everybody wants to feel safe in this city, and that is the challenge that we have. And part of the reason why we have the drug crisis resolution, this has to be our #1 public health and public safety priority. So I will stop there so that you can ask questions, so people can ask questions.
Okay, I have a feeling there's gonna be a lot. How about we'll start in the room and take a few questions in the room, and then we do have like 10 or 12 people online, so we'll kind of flip back and forth. And if you could just start by introducing yourselves, because folks who came in late may not know who everybody is.
My name is Jim Brown. I'm a resident from Clymer Street. My question is, has anyone, any group, any organization done some kind of a survey or census with the appropriate privacy considerations and all that, to try to find out who the people are that are homeless, where they came from, what their story is, to come up with a better solution for what's happening? Does that information exist?
I don't know who wants to speak to that. We do have that, but whoever wants to.
There are surveys done, head counts that help us determine that. Has somebody gone and interviewed every single person and taken that down as data?
Yes.
In a way that collects it? No, not to my knowledge. I think the people who work most closely with these populations know many of these people quite intimately, and have helped them in some cases for years now. And yet we also have a larger population than we've ever had. I mean, normally there were 40 to 50 people who were unhoused in the community in Burlington at any given time. That has quadrupled. And there are a number of people who are relatively new, who come in, street outreach. So every morning and every evening, we hold a roll call at the police department. That roll call includes members of the street outreach team, which is a component of Howard Center. It includes members of our community support liaison team, who are in-house social workers employed by the Burlington Police Department. It includes members of our community service officer team who are unarmed, unsworn members of the department who enforce certain kinds of municipal codes, but don't have weapons and can't make arrests. And then, of course, it includes our officers who are going to be doing the response to crime calls and issues where safety is at stake. And those members team back about all this stuff. They talk about individuals in the community who are experiencing mental health crises or who have been, either improving or unfortunately sometimes decompensating over the last several days. People with whom we've come into repeated contact in a short period of time. Just today, we had to take a woman into emergency custody via an emergency evaluation order because we've had 18 contacts with her since very late August, and this particular one involved her going and threatening people in the public sphere, attempting to assault a neighbor, making horrible statements towards parents and children leaving schools along North Street. And so she was taken into custody and taken for an emergency evaluation. So we team back about that kind of information. In the morning, it might be we worry about this individual, and then in the evening roll call, it might be this happened today, and now these are things that we may be looking at. We know a lot of these individuals by story and by background and by repeated contact. But what you're describing, no, I don't believe that that's been done.
I think you just illustrated a good point. There's so much activity and so much diversity. It's easy to get down a rabbit hole on all the details. I think it would be useful to have one person or one committee have all the data that can be collected to try to abstract some bigger picture issues from this, to try to see if there's a clearer, less hazy picture that comes into view about how to go forward to solve the problem.
That may be something that Sarah Russell either has or is working on, but it's not something of which I know for sure. Okay, thank you.
Sarah actually is working on documenting each person to the best of her ability on, the people that obviously, as Chief Murray said, the people that are doing this work daily, you know a lot of the people that are unhoused. And she is making every effort to literally document each one of those people. So that effort is being made, but it is not an easy, as you say, it's a fluid and evolving situation. So it's not always incredibly easy, but that effort is being made.
I'd also like to note that there's a very distinct sort of separation in the unhoused population between those who are unhoused, sometimes for economic reasons or things that many of us in this world live very hand to mouth. And it doesn't take a lot to push somebody over a precipice into a situation of being unhoused. That is one sort of category of folks who are unhoused. Many of those folks do attempt to find housing in the motel system, in other kinds of ways. And there, helping them requires one set of skills and one set of social service options. Then we have people who suffer from chronic mental health issues, from substance use disorder that oftentimes is a means of treating those chronic mental health issues in their own way. And who also are often a locus of crime and commit crimes and disorder issues because of those two sort of co-occurring medical conditions, substance use and mental health. And those folks are the ones who are the most pressing in our public sphere. They're the ones we notice the most. They're the ones who cause the most consternation. They're responsible for a good number of our bike thefts. They are responsible for the open air drug use that makes our public areas less conducive to having other people use those public spaces. And it's a different kind of homelessness than the 200. I don't think that we have 200 people living in that way. I think it's probably closer to 40 or 50 living in that way.
Other questions or reflections?
So, I'm Fleming, I'm with the University of Vermont Student Government Association. Is there anything you would recommend we provide for students on campus and students off campus as public safety resources so that they know, like, when they go downtown, how to engage in a safe way and in a healthy way, both with the city as a whole, and also with people in crisis?
Great question. And I don't want to answer every question. I think there are tools like that. We have some on our website. I don't see a lot of issues with students actually running into those kinds of issues most of the time. I think students do sort of know how to engage with folks. If somebody's in crisis, I think you need to call and seek, assistance from street outreach, from the police, from fire. But with regard to being, safe in the community, many of these issues are not issues that have necessarily, certainly property crime affects students, like it affects anybody in this. Bike theft is a big one. And it's a wake-up call to leave whichever community you're coming here from and have your bike on a semi-secured, back of your car and suddenly come out as you've unloaded the rest of your stuff into the dorm and find it gone. That's awful. And it doesn't leave a good taste in people's mouth about our community or our city. That affects everybody. However, the notion of actual, safety, I don't believe that that's something that's tremendously likely to harm our college student population. But I understand that it is out there and there's concerns about it. I think that there are, there's probably an opportunity there for us to try to create those kinds of resources and figure out if there's a training or a community meeting. I'll certainly pull it a plug for the community academy and say that we'd love to have students attend that. But that's probably an opportunity for us.
Other folks wanna add to the response to that question? Okay, other questions or reflect? Oh, I see somebody online. Becky.
There we go. I had a question about the, if you have a sense of how many families are unhoused, and because I don't see that too often, but I imagine that they're out there. And are there what's happening with those folks?
I know that I don't have a sense of that. Typically, the folks we see are individuals. I'm sure there are families that are unhoused. Again, I think that'd be a question for Sarah Russell. It's something that I would imagine that she's tracking.
We certainly run into couples. Occasionally there will be individuals who have a child with them, but those aren't generally long-term. Those are sort of folks who appear in a moment and then disappear either as they find other sources of housing or move to other communities. Those aren't folks who are sort of long-term people who live unhoused part of the time, but are in Burlington most of the time.
And the information.
I'm sorry, I was just getting, this might help because I was gonna ask you, Karen, you brought up the number 200 and then Chief Murad, you mentioned it too. Are those 200 like not in even temporary situations? In Chittenden County, you said 200 homeless people. Or are we counting people who are housed in cots and in hotels and doubling up? And because I think that's like in the school district, obviously, we know we have homeless families.
Yes.
And the vast majority of those are living indoors somewhere. Once in a while, we have people living in cars, but usually we are able to fix that pretty quickly. And so I just to clarify that number 200, what is that referring to?
That's a terrific question. And both Lacey Smith, who runs our community support liaison team, or Sarah Russell would both be folks who could answer that better than I. I do believe that it includes all, and I believe that it includes therefore people who are at cots, who are at the hotels. I think the number would be a lot larger if it didn't. But as I said, I do think that, there's a distinction between the folks who are they're unhoused and that we're trying to find permanent housing for them.
Right.
But they are nevertheless currently housed. And the kinds of the families that you're talking about who are in the school system, those are in that first cohort I talked about that are in some ways invisible to us in a good way, in that they're not causing they're not bringing attention to problems in the public sphere, but not hopefully invisible in a way that we're not catching, because we want to know about people that are in that condition. We don't want a young student who's houselessness situation we don't know, because then we can't address it or help them.
So then and then you mentioned the number, and you were estimating like 40 or 50 people, I think. Is that folks living outdoors right now?
Right now, yes.
Yeah.
And some of that living outdoors, we will see they won't be living outdoors when the weather changes. They will find ways to either to move in with friends, relatives, abide by rules that they sometimes don't otherwise wish to, or that are very difficult for them for a variety of reasons. Sometimes living out is, I hesitate to use the word of choice. It makes it sound like it's something that is almost something that's sort of capricious. But there is an element of other options, but this is the one that I'm taking right now.
Question, Bonnie?
Yeah, I'm wondering if anyone can speak. Folks at the Howard Center that xylazine. Do you have any sense of what the breakdown is and what kind of programs there might be or responses are available when Narcan isn't an option?
Xylazine is definitely in the community.
So for those of us who maybe aren't well enough informed, can you start by explaining the question a little bit?
Well, I think you're asking about xylazine, which is a horse tranquilizer, I believe, that is being added to street drugs. And it's an add-on that's inexpensive, and honestly, folks don't even know that it's in their drug. It causes sores and skin failure, honestly, on a lot of folks. And I know we're seeing a lot of xylazine injury in the community. We're handing out a lot of bandaging, things like that. So the other part of your question.
I'm just wondering what, like, are there awareness campaigns or testing?
So there are xylazine test strips that people can have. When we hand out Narcan leave behind kits, they typically have xylazine test strips in them. And we are actually working to get test strips alone so that folks just want test strips that we can hand them out. But we are getting xylazine and fentanyl test strips along with those Narcan leave behind kits.
One of the things that for those watching or other people in the room, one of the things she mentioned that you mentioned is the idea that Narcan doesn't work on xylazine. So Narcan is an opioid inhibitor. It's actually called an opioid reuptake inhibitor. It basically prevents somebody who's overdosed on an opioid from having that opioid continue to do what it was designed to do, which is to go into certain receptors in your body and make you high. If the Narcan is there, it actually blocks those receptors and the high goes away. It can return if the dose was sufficient, but in most cases it reverses overdose if the source of the overdose was an opioid, or whether that's a synthetic opioid like fentanyl, which is the primary one that's available in the marketplace now, or heroin, or even if it were true opium, which simply doesn't exist, but obviously it was something that once upon a time, 100 years ago was out there. Narcan works to reverse that. If the overdose is being caused by a polydrug cocktail, which is often the case, includes any number of things, many of which the user does not know are there, then the Narcan becomes potentially less effective. And then that is a concern for us.
Scott, I wonder if you
Yeah.
had anything.
No, I mean, touch upon it. I mean, I would really stress the fact that the way you phrased your question said for people for whom naloxone isn't an option. I want to stress that in any suspected overdose situation, you are still using Narcan 100% of the time and calling EMS and doing rescue breathing, but you're not going to see in street drugs in street drugs, you're not going to see xylazine on its own right here in Vermont. It's going to be involved with opioids. And while xylazine is a different sedative that can complicate that it doesn't remove the efficacy of naloxone entirely. So I would just really emphasize that that's still very much a role. And I know people have left xylazine conversations thinking like, oh, well, naloxone doesn't work anymore. And that's the last takeaway we want people to have.
Thank you. Great.
Other folks? Other questions or comments? Alan?
Yeah, so this is a similar question to the one asked by the UVM student, but what can we as community members do? And, I, over time, have had different thoughts, and I don't know if any of these are effective or, should be done, but one is to learn how to use Narcan and potentially carry it. Two would be, what about trying to pick up needles if we see them or find ways to dispose of them? Three is how do we just, help out the community? I heard Victor say, students feeling threatened as they walk by places, is there, other things for the community to do to possibly just be more on the streets? And partly why I asked too is I have a couple different places that I'm often where there are, people who, as it was described, potentially make me nervous, also make me very, feel sad that the situation is as it is. But, I have an office that's in an alley that we often have needles in. I work at a school that has a playground that we do needle sweeps every day, and try to find ways actually to discourage folks from showing up on these playgrounds. So I'm kind of asking, what are some other things we can do? What of those things that you've heard from me are effective? And, maybe there's things I'm sure there's things I'm not thinking about that could, help within the community as just as somebody who lives here and wants to keep part of this and and wants to keep trying to make it better without just, causing more problems. That's it. Thanks.
There is a city service C-click fix, if you know what that is. If you do see needles or, if you've seen them in the community, you can use C-click fix, and we do have folks in the city that will work to clean them up. Picking up needles on your own is, I understand why you'd want to. Just getting rid of them, it's dangerous to pick them up, and they're not easy to get rid of. So I would recommend using C-click fix as your first resource for needles.
There are instructions on the Vermont DMH, I believe, website, the Department of Mental Health, that has instructions for how to pick up needles safely. And I think we had a link to that as well at one point at the police department webpage. But Chief LaChance is right. I don't know that people should feel comfortable doing that. They should be, cognizant of it. We have workers and employees who've gotten stuck with needles in attempting to both pick them up and in dealing with people who have hidden needles on their person. And it occasions you've got a couple of weeks sometimes of taking treatment or worrying, am I going to find some kind of untoward result from this medically? And that's no fun.
So I'll just emphasize that needle injuries are concerning and possibly dangerous. Needle sticks are. Handling a needle is not. And unless you are stuck, it is not a medical situation to encounter a needle. But I know there's a lot of apprehension about what is the effect or what is potentially caught or transmitted by picking up a needle itself. I know when working with Parks and Rec, we get a lot of feedback on needle stick injuries that occur from improper needle disposal, but these are needles that aren't seen on the street, but thrown away in garbage bags and then poking out the side. And then that's something that's really hard to present. I also want to say that while if you ever experience a needle stick injury, you always go to the emergency room. The chance of you getting any blood-borne disease from a needle that was found out in the field is incredibly low, less than I think the prevalence from academic studies suggests that the rules of threes, you're looking at a less than 1% chance of catching anything. Of anything, and that assumes the highest period of transferability. So thinking that yes, it's most dangerous if someone had just had a bloodborne disease themselves and then discarded that needle. If you picked up that needle within 30 seconds and stuck yourself, that's your highest period of catching anything. Just the odds are just so incredibly low. That's not to say you wouldn't seek out medical attention to healthcare, but I just want people to have an accurate assessment of the risk they face, because certainly picking up needles yourself is an option, not an onus we'd ever want to put on the general community. We need better, more comprehensive responses for safe disposal, but at the same time, you shouldn't feel scared, especially at the prospect of, that's a needle that someone else might not see and then step on, and then they have a needle stick injury. So that's all.
The only other thing I wanted to just mention is there are groups of citizens who do oftentimes accompany Parks and Rec employees in helping to clean up encampments. And oftentimes when they do that, they're doing that with encampments that I imagine Lacey and others at BPD have determined are abandoned. So no one is living there. And once they've determined that, then we go about trying to clean them up. There was one that I went to about a month ago that is just over the wall going down Battery Street, and it is in a very, very steep area. We were there for, I don't know, probably about 4 hours. When we left with the bags that we had taken out, I don't know that you would have known that if you saw what the encampment looked like when we left, you probably wouldn't have known that we had been there. There was just so much, so many items, just an amazing amount of items that were in this encampment. It is incredibly difficult work. The people who do this work deserve, just all of our first responders just deserve a huge debt of gratitude. You couldn't say enough to see the kind of work that they do. And but there are groups of residents who do go and do this work. They don't do it alone, and I wouldn't encourage you to do it alone. We went with, I think there was an urban park ranger and there were 2 Parks and Rec employees that did this. So if you have an interest in doing that, let me know. I'm sure we can put you in touch with people that you could do this with.
Are there needle disposal sites?
There are, some of the parks have them. There's one I know of for sure in Battery Park in the center, near where there's a sort of a circular seating area. And they're in other places as well. Bathroom, yeah.
In 13.
I'm just asking this, I mean, I pick them up on my street. Yeah. Because it's worse to have a little kid pick them up. And I'm picking them up carefully.
On that point, I mean, I think Alan mentioned there's needle sweeps in playgrounds and things like that. And you can imagine people hang out on playgrounds late at night and there's not many lights. Is there a comprehensive response to that? I mean, kind of addressing playgrounds in particular where there's going to be kids, because adults can generally avoid these things, but kids don't know necessarily better if they're little.
So C-Click Fix, which Chief LaChance mentioned, will generally report that out to its code, right? Or is it DPW that goes? But for something that is found in a playground, that can be reported to police, and police will respond if available.
Okay.
The availability is going to be predicated on that priority response plan that we have in place. And that's dictated by the number of officers that are on the shift and available for that kind of response. A needle, even in a playground, is not going to be necessarily a priority one. We don't have a single code for it either. It would probably be, I'd have to think of what that would be dispatched as by dispatch, but.
Yeah. Just to follow up then, are there any regular sweeps done of the playgrounds, or is it more relying on citizens to see this stuff and report it?
We do them in schools every day.
Yeah.
Our custodians, we needed to train them to do this. We're doing sweeps for both people sleeping there, stuff they've discarded in needles. In the Old North End, downtown, the Edmonds campus. And yeah, those are the areas.
Boys and girls in King Street Center also do it for playgrounds that are either on their grounds or in proximity. But a playground such as, for example, the one in Oak Ledge, right? The wonderful new all access playground that's been created. One of the only in the Northeast, I think. I don't know that there's a specific parks plan to go and do that. I know that it happens when parks employees go. But is there like a sweep? I don't know the answer to that. That would be a parks question.
Yeah, the only thing I know in terms of, I don't know about the sweeps. I know that in terms of encampments, if they are prioritizing, addressing encampments in the order of the first that are addressed are ones that are near playgrounds.
Okay.
There is I won't go into all of the issues about sheltering on public lands and the policy that we have regarding sheltering on public lands and what gets done first and what is allowed and what isn't allowed and all of that. But the Parks and Rec Department is so really overwhelmed with so many that their first priority is those that are around playgrounds for obvious reasons.
Thank you.
So I just had a thought. C-Click Fix. So I've been in tech for a while, and the thing I always talk about is meet people where they are. So instead of relying on people to know about C-Click Fix, have we considered maybe having QR codes at different places? Because people are always carrying their phones to say, hey, if you see a problem, and then they have a quick shortcut to get to that.
Good idea.
Yeah.
And then based on the QR code, you could also have it, have the location baked in.
So it's like see an issue, click on that.
That's right.
Brings you to the C-click fix.
You got it.
That's one of the advantages of the community forums that we're gonna be having. Is that since the community forums were announced there, I can't tell you how many people have come up to me and said, you know, obviously you're braver. Some people will actually say, well, I've had this idea, but I don't think it'll work. I'm like, well, I don't even know if it'll work because you haven't told me the idea yet. But the reality is that there's a lot of ideas like that out there. And as a community, we really need to come together and find them. And a lot of them don't really cost very much money.
Yeah.
That is something that it's a great idea. We should do it.
Yeah.
Karen, I just heard you say community forums.
Yeah. Those are the ones that we're going to be in December 13th and 14th. One of them will be in Contois. I think the one on the 14th, the 13th, we're still working on the location, but we will have two of them.
Okay, so I think that's actually also a good part of the answer to Alan's broader question of what can we be doing is show up at the community forum.
Yes, we hope you will.
Okay.
And just to touch on your point about, sweeps and things like that, Ted Miles from the Code Enforcement Office goes out every single day of the week and picks up 100 needles, all these different locations. It's
wild.
Heroes out there doing this work. And he's always kind of, he's down at the Department of Public Works building. And he actually helped us train our custodians and like, what's an easy way to do this? Because we're, you can fill a needle container in one day sometimes. So he kind of has the easy approach of using a Gatorade bottle, which is super strong plastic, and putting it on the ground so that it's sideways and popping a needle in there and closing the lid. And it's an easy, quick way of getting it into a trash receptacle that then won't get in someone's hand. But there are ways where if you see one and, C-click fix isn't an option, or you just want to deal with it, it is pretty safe.
Yeah.
Our custodians are doing it every day down at our buildings and things. So it is just a matter of looking at the resources that can kind of give you those safe tips around doing it. So,
I would just say the one advantage of empowering the community to self-report is it'll give you the data.
Yeah.
You'll see if there's a higher incidence of there we go.
And that is that, for sure.
There you go.
Nick, are you guys having needles and people sleeping in the garage down on, what is that, Maple?
Yeah, Maple and King. Yeah, it's kind of a public garage, but it's under our building.
Yeah.
And so Ted sweeps through there daily too, and then we sweep through. Our custodians are there every day, and we're dealing with it.
That's my running route. So often at 6 a.m. I see people coming out of there. I'm like, did you just park your car? So I don't think you said.
No. And we've done a lot of crime prevention by environmental design kind of work, adding lighting, putting up, window cages so there's less places to hang out, changing heat ducts and stuff. But we're just managing at this point.
I want to know that there's a question online about C-click fix. Sarah asks, we've used C-click fix on several occasions and never saw resolve. Where do those requests land and how often are they checked?
Well, that's probably the best person to answer that is probably Bill Ward.
Yeah.
Who's not here. But my guess is that they're checked often.
Ted checks daily.
Yes.
I can't verify how often he closes out reports. If anything, I think in the last ComStat meeting he was able to attend, he indicated that he was so busy, he was just focusing on picking up the needles as opposed to closing out the reports. Which of course is incomplete data, but he's a one-man hero operation. So what else can we ask of him? But yeah, so they are getting addressed, they are getting seen. And certainly if you notice something after, if the needle remains after making a report for more than one day, please do reach out to me or Ted Miles for more information. We'll get someone out there.
Thanks, Scott. Sarah, I hope that answered your question.
Karen, can I ask you a question? I know you were you sponsored the resolution that was passed. Would you mind just giving a quick overview of what that means? Because we've heard some discussion around how tight resources are and how, teams are overwhelmed, which they absolutely are. Is there any opportunity to increase resources for those groups or teams, as a result of the resolution?
To increase, well, the resolution had resolve clauses. One of the main resolve clauses was to, there were a number of them. There was a request to get more data from the Chittenden County State's Attorney. I think there's a lot of concern out there of, there's a lot of cases that, some of them are backlogged. Some of them, my understanding from the state's attorney is that there's some that are still backlogged due to the fact that the courts were closed for, I know it sounds like a long time ago, but it was a long time ago. They were closed for 2 years, that there was still a backlog from COVID. So there was a request for more data because people are looking for more data. I mean, you talk about data, everybody wants to know about, like on a daily basis, Chief LaChance could tell you how many overdose cases they have responded to. It's pretty amazing. They have all of that data. And so a lot of people are looking for greater transparency. Then there were the community forums. There was also a request, I think there were a couple of it. I don't remember them off the top of my head, but as far as the community forums, those were the resolve clause was that the community safety committee, the public safety committee, together with representatives from police, fire, the schools, health officials, harm reduction, reductionists would all get together to form these community forums. And then what the ideas that come as a result of them, those would then be funneled to the administration. They would go to the department that was most closely able to address that. And the best example of ideas coming and being able to be implemented, although it came from the firefighters, is the crisis response team. And that night on the 10th, it was a great meeting because we heard a 30 or so minute presentation from the drug crimes unit. They did you proud. It was a wonderful presentation, and I think we all learned a lot. And we had the resolution, and then we heard from the crisis response team, which already has gathered. I don't know. You probably know as of yesterday exactly what the response was, which has been great. My understanding is it's a pilot. And in 6 months, we're going to have to reevaluate before we get to the 6 months. But hopefully the goal will be, if it's a successful program, that we figure out how to fund it. Right now, it's being funded with opioid settlement money, and it's overtime. It's voluntary overtime. We cannot do that indefinitely. So there will have to be decisions made and going into the budget for the next year.
Yeah, one thing I've said from the beginning is we want the data to see if it's a useful program. If it's not solving anything for us, then we need to do something different. Let's not, so it is early. But from what I'm gathering from our folks, in 2 weeks, we've been on, I think 55 initial 911 calls that it's responded to, but it has a much larger impact than that. They are going into these areas of homelessness and drug use, and they are reaching out to folks. The first week they handed out, I think, 68 Narcan leave behind kits. One thing we're seeing, or this group is seeing, is there is evidence of those kits being used. When we talk about 422 overdoses so far this year, I think Chief Murad would agree, we're only seeing a piece of those. There's a lot of folks that are taking these Narcan leave behind kits and they're using. And I think that in the communities, there's a lot of folks that are overdosing that we don't even see. And again, there's evidence of those kits being used. I don't think we're handing them out and they're ending up in a junk drawer at somebody's house. I think they're being used. So,
as an indicator of that, my fellow police chiefs around the county tell me that they are not seeing the increase in overdose that we have seen. We've seen, more than double the number of overdoses in 2023 that we saw in 2022. And 2022 was an abysmal year, an awful year. We're not seeing that in other communities. Overdose for us is not a fatality. It's an indication of the person displaying signs of having overdosed on a drug. And then generally it means that we actually are able to either intercede or the person revives or the person is transported to the hospital. A fatality is different. What we are seeing, however, very sadly and terribly is that the fatalities are up in the rest of the county more than they are up in Burlington. Thank God we're not seeing a commensurate increase in fatalities that we have seen in overdose, right? We're not seeing double the number of fatalities or triple the number of fatalities this year compared to, say, 2021, although the number of overdoses is probably close to that, if not more. But the other parts of the county are seeing their death numbers uptick a little bit more as a rate from previous years than we, and yet they're not seeing the overdoses. What that says to me is that our overdoses are far more public. They are being driven by, the response is being driven by people noticing them, and people notice them because they are out in the public sphere. And it's somebody on a park bench, it's somebody on the green belt, on the green belt as people drive by saying, oh gosh, that person, I just drove by, but they looked like they were in really bad shape. Can you tell me what was really happening? No, I'm not even there anymore. That doesn't happen in Richmond or in other parts of, in Williston, for example. But those folks are suffering the same way. And I don't think the rates are any different there than they are in our community. It's just done in secret. But even some of ours, as the chief says, are in secret as well. We're not seeing all of them.
We've got another question online from Catherine Anthony. She notes that Iceland implemented a scientifically proven drug prevention model. 10 years later, their need for substance abuse treatment for men from 20 to 25 went down by half. And in addition, crime significantly declined as well as sexual violence decreased. So Catherine asked if we can revisit investing in a serious way in a scientifically proven substance misuse prevention plan for Burlington. Karen, I don't know who can answer that question, but I'll just start with you because
I do remember.
I think comes.
It does, although I have to say, I've had this conversation with Catherine a long time ago about the Iceland model. I don't know, Scott, you're probably more familiar with it. I don't remember. I know that it started very young. It had its roots in early in childhood education, I believe, and in after school programs that they seriously, significantly invested in. But you probably remember all of the particulars.
I don't, especially with Catherine on the call or online, I definitely don't want to misspeak about that. That is my understanding, my recollection. I will say, as a member of both the Misuse Prevention Council and the Settlement Advisory Committee, the Settlement Advisory Committee, one of the first 13 tasks we are asked to allocate funds for is the prevention of opioid overdose deaths. And at a time where death is higher than ever, it's certainly hard to make the necessary investments we need in prevention modeling, just because the situation and the need for treatment and harm reduction is so dire. That's not to say we'll never get to the point, but when weighing funding opportunities to be supported by settlement dollars, I know as an individual member of the committee, I'm drawn to first look at how do we keep people alive? How do we keep people alive and then help them live a better life and a life that requires less of the many traumatic experiences that go hand in hand with living with insufficiently treated substance use disorder. So it's not to say that that's not something the state might look at in the future, but thinking about this next fiscal year and how we'll make recommendations related to, I think, $15 million. I couldn't say that the Icelandic model is something that is going to be on the agenda this fiscal year.
Anybody else want to add to that?
If I had a dollar for every time I had a good idea for funding that came to me that I had to say, should get that dollar, that I had to say not right now. Unfortunately, even in thinking about $15 million, that isn't enough to do everything that we can readily say we need to do to improve public health and public safety in our communities.
Other questions or comments?
A very broad question, which is just where does housing fit into this? It seems like that's another, maybe long-term investment that's not necessarily as pressing as the immediate need for help. I'm wondering if that is at all, like what initiatives are there where people are going to live.
I would say it's definitely as pressing. Just because houselessness, housing insecurity increases someone who's living with substance use disorders odds of experiencing mortality. I think that housing insecurity and homelessness is also often an on-ramp to substance use disorder, especially when that coincides with a poorly treated mental health condition that wasn't substance use disorder to begin with. So when thinking about reducing mortality, and finally, the third point is, it's really hard to get into treatment or get into recovery when you don't have stable housing. Like it's next to impossible. It's impossible. So looking at settlement funding opportunities for this next year, I know that we're going to be relying on some recommendations from the Chittenden County Homeless Alliance to really see what we can do to build not just congregate shelter, but temporary and permanent housing for people who either need short-term stabilization to make themselves eligible for other housing programs, or just again to get people in safe spaces. But no, I would say it's just as pressing when talking about the ways in which we can reduce mortality. We need to make sure people are housed.
We did try on Cherry Street to use the state office building. We had made a proposal, as you may have heard, for housing there, and I believe it was 50 to 60 people that could have been there. It was obviously there was a cost with that, and so we applied for a grant from the state. We were denied that. The state came back and said that they didn't feel our housing, our need was that great. And so we weren't able to secure that. We did respond to that, and I mean honestly, Sarah Russell wrote an amazing letter. And as of now, that is just not happening. But that would have been at least a part of a solution. I mean, the reality is that there is no, one of the reasons why this challenge is so difficult is because it's individual people and individual circumstances, and the way that we're going to get to a place where people are living is by literally, as you were asking about, do we know who these people are? And I think to a large degree we do. Some of them will be in housing in the winter, and that will be an opportunity to know who they are, what their individual circumstances are, and hopefully that will be a way for us to be able to secure some place for them when it gets warmer out. But it's a constant challenge. The Sarah Russell is amazing. She was hired to be the special assistant to end homelessness, and unfortunately she still has a job.
Karen, who denied at the state level that funding building you mentioned?
So the letter was sent to the Secretary of the Agency of Human Services. That was who, I don't know if that was that person, but it was done through that agency.
Okay. I've got a follow-up question actually related to that, which is, you've all talked about various community partners in all of this work that you're doing. And one organization that I didn't hear identified, and I'm kind of curious in light of this last question, is Champlain Housing Trust. And just curious how the city works with Champlain Housing Trust and if they're part of this process and part of the solution.
Well, CHD is running and managing the pods on Elmwood. So on Elmwood, just north of Pearl Street, there is a little, it's on a former parking lot, but it's a small village of pods. These are single occupancy, tiny homes, and people who were unhoused are currently housed in there. They have rules that they have to follow in order to live there, but it's For the folks who are inside and the folks who've been able to stay to those rules, it's been, I think, a great success. And they are better off for it. It hasn't been all successful entirely for the neighborhood that it's in. Because although the folks who are inside the pods are not really are obeying rules and doing the best they can to get back on their feet with the social services that can now connect with them in one single place in a much more sort of efficient way. Other folks who aren't housed but are associated with these individuals who sometimes either buy. We believe there's some narcotics transactions that are happening there and in the vicinity, and that causes a lot of disorder in the immediate area. And that disorder is very troubling and unfair to the neighbors around it. The neighbors are experiencing real problems with that. But there's a balance there that is going on. In the net, it is a program that is good. It was put together. I think it would have been much more impactful for us if we hadn't been simultaneously inundated by a much larger homeless population that we really didn't anticipate, expect, or had ever experienced. And so once upon a time, the idea of getting 30 people housed would have been a big chunk of our, the sort of obtrusive, and I don't mean that in a pejorative way, but the noticeable component of the housing population, of the unhoused population that is out in the public sphere. Getting 30 into these pods would have been a really big deal. Now it feels a little bit like a drop in the bucket, and that's unfortunate.
Well, in fact, that you raise a good point, and that is that when the pods were first planned, this was way before the release of 800 people from the motels that happened in June. And so when that plan came forward, I think that was the idea. I think we thought that was going to be a significant victory in terms of housing people that had nowhere, who were unhoused. It just didn't work out that way.
So I do have a question, or it's a statement. There are some things, as you just alluded to, that were just out of our control. Fentanyl, xylazine, out of our control. We had a known unhoused population that were displaced. I guess my question for all of us is, when did we know the pandemic funds were running out and that the motel program would end? This isn't just a real question. We didn't anticipate the onslaught of folks, but as one of the key cities in our state, whether it's Burlington or Brattleboro, that have resources, it seemed like a natural consequence of what would happen. So I'm just asking for us as a community to lift our heads up a little bit more. And unfortunately, we didn't anticipate it happening, but it did. So I guess on reflection, when could we have known?
When could we have known what? That there were
that the program was ending and that there was no contingency plan for those folks who were going to be unhoused?
I think that question is probably one that's best to someone in the legislature.
Yeah,
they were the ones that, that was not a Burlington decision. I mean, the hotels were costing, my understanding is, were costing about $20 million a month, and it became an unsustainable amount of money. There probably were some inefficiencies there. And when that decision, when that was known, I honestly don't know the answer. I don't know. Perhaps either one of you might know when that actually became known.
I know.
I don't know. You know.
You don't. No, I mean, I was just going to back you up to say, I think that if you ask people in the legislature or in the governor's administration, you're going to get differing answers on when we could have known. It seems like, speaking for myself only, stepping away from everybody, that there might have been an information asymmetry that might have resulted from some negotiations maybe not taking place in good faith, that maybe more could have been done, or maybe there could have been more transparency about that this Band-Aid is being ripped off soon. But for whatever reason, that messaging wasn't clear until we were caught in a state of near emergency with the amount of people released on the street.
There was phasing to it. I know that Lacey Smith was paying very close attention to the timeline. The phasing was, at first there was a date and then there was pushback and that date changed and then there was a phased date. And it was known that we were going to face an increase. I don't think we anticipated how large an increase by any means. I don't know that we really could have. I think there was an exacerbating factor too, which the kind of polling that you're talking about, or census taking rather, that you're talking about might be able to address for us in a known way. But we presume that we've gotten a number of people because of flooding. That the floods in the summer exacerbated the problem in ways that we could not anticipate, and that we're dealing with folks who otherwise would be addressing their needs in communities from which they come, like Barry, like Montpelier, like, you know, maybe even as far south as Ludlow and other places. But we don't know that. And that is the kind of information that I do think a census might assist us with. I don't know how much data we get out of a census when we're still talking about a relatively tight population of 200. There's not, you know, sometimes the small numbers like that make it difficult to sort of draw pictures of, well, X number are, you know, studied at the Sorbonne and X number did this or that in some ways that allow us to say, well, now we can really hone in on whether or not, neoclassical French studies is a way for us to make connections with these folks. I think not knowing exactly when those dates were coming and then having it exacerbated by a completely unanticipated environmental event was definitely a factor in what we're facing. But the truth of the matter is that this was a situation that was in fact addressed during the pandemic. The specific problem of houselessness was greatly diminished because we housed people for a very long time, but we did it in a way that was not sustainable. And although we can believe that more could have been done at the Montpelier level on both the executive or legislative side, although we can say that, you know, maybe there were inefficiencies, as you say, Council President Paul. The fact of the matter is that it wasn't sustainable, not monetarily, and not without the huge influx of federal dollars. And who knows where federal money comes from? I mean, it just kind of comes. But state money doesn't. State money has to come from all of us. And we don't have the money to do that at the state level, even the state levels. Do we need more assistance from the state in Burlington? Absolutely. But is there money to be had? That's a very open question. This is a tremendously expensive problem if we really want to address it. And we haven't even touched on the parts that are public safety crime issues. And then we don't have the resources for that right now. And so for us to actually address all these things is we have deep desires to make these kinds of fixes. And I don't believe that our actual wherewithal is commensurate with those desires.
I mean, clearly, if we had known in advance, think about what would $20 million a month buy us? How many motels could we have bought? Could the state have bought that were not really functioning that well? Could they have bought to house people? If we could like sort of freeze time, be able to catch up by a couple of months, be able to do all of that infrastructure, think of how different things would be. But we didn't have that opportunity. So I think that is, but I agree with you, for all the things that we would love to see, you know, there is only so much. And the way that I look at it is that, you know, we could all, there's plenty of finger pointing that could happen about mistakes that were made or inefficiencies that were created. None of those are going to solve the situation that we have now. And we need to, it's just my opinion that we need to not be doing that, but be focusing on all of us working, no one competing against each other. We don't need to be competing against other municipalities. Rutland has per capita a worse homelessness problem than the city of Burlington. There are people all over the state in need. We need to not compete against one another, but find a common solution. Or that is the way for us to really resolve this.
Yeah, I will just say for me, it's not about finger pointing at all.
No, I didn't mean that.
Okay, yeah. For me, it's, you know, it's like any sort of postmortem. Is there something we could have done better?
Well, and
lessons learned.
Exactly.
I will summarize a comment that Karen has that's up there that I don't think anybody can read in that small type, but basically, Karen, your point about, you know, what could we do with that $20 million if we hadn't spent it on that? Catherine is making the point that we need to find money for prevention. Because that will save, because those are the better
Those are investments.
long-term fixes.
Right.
That's the point that she's making, and I'll share the exact comment that she made with the folks on the panel later. Nancy also wanted to go back to the question about the state building. And Nancy asks, what do we need to do to get the state building? This is a big deal. So I guess the question is maybe put differently, is there anything that could be done? Is that still a possibility?
I just saw an article yesterday, I think, and it had a picture of the building on Cherry Street and said $29 million state wanted to go to.
There may be no answer for Nancy.
I don't know the answer to that. I know that we made the proposal. My guess, and again, it's really a guess, is that grant funding went to something else. That would be my guess, but I don't know for sure. I would have to find out, but that would be my guess. It was a finite amount of time, and I believe it probably went somewhere else.
Yeah. Are there other questions? Yeah.
I've heard comments from people who aren't necessarily interested to know that people are attracted to come to Vermont and to Burlington in particular from other places because of the generous welfare benefits, whatever we have. And I don't know if there's any truth to that, truth to that. I wondered if any of you could shed any light.
The majority of the people with whom we interact are people who've been in Burlington for quite some time. How did they originally come? I don't know. I think that to a certain extent that is a little overstated. Again, the census that you propose would probably be a good way to drill into that. I do believe that there is truth to the idea that if you want more of something, you subsidize it. And we have subsidized a lot of different kinds of social services. And that does create an impact. I think that is something that is a challenge we have to reckon. And that is a way of thinking, as we think about long-term, what we're going to do or not as a community. But in the immediate moment, we have these needs, particularly as winter draws closer, that we, irrespective of how people got here or why they got here or where they came from, we need to be able to keep these folks safe. They're in this community now. Many of them are going to be endangered by the shift in the weather. And what are we going to do about that? But the majority of the people with whom we as police deal on a day-to-day basis, particularly around that disorder, the people who are strongly in the second cohort of homelessness that I talked about, those are folks that are they're Vermonters. They're from Vermont. They're here now. We're a state where if you weren't born here, or even if you were born here but you went away for 20 years and came back, you're still not really a Vermonter. So who knows what that means to be a Vermonter? But these are folks who are here, right? They're not folks who just got off a bus because they were living in Charlotte, North Carolina, or Burlington has a really good the pods on Elmwood are really swell.
I don't.
They're that too.
Yeah, I don't think there's much research, if any, to really affirm that houseless populations have significant migratory patterns based on social services. But there has been research to affirm that if there are good social services, you're less likely to leave. But in terms of that being a motivating factor that's going to get you somewhere, that's probably not the case.
I think that is, I mean, the information that I've gotten when we in the work that Sarah has done to try to document does prove that out, at least from what we know, that the people who are unhoused are not people that have come here from far distances,
maybe as far as Paris.
I mean, some, yeah.
Yeah, but there's
some, yes, of course, there's probably a small percentage, but it's a misnomer that these are the vast majority are people that have come here seeking services, because they've heard that Burlington is, offers services, or Vermont does.
I think I saw her hand over here.
Yeah, getting back to, excuse me, the survey idea again. I think if you just ask 3 questions, where did you grow up? How long have you been in Burlington and why did you come here? If that information showed, for instance, that there were a lot of people here from outside of Chittenden County, what can you do with that information? You can take it to the legislature and say, look, we got a lot of people in Burlington asking for services. It didn't grow up here. We're happy to do it. It makes some sense. There's a benefit of scale and all that, but we need some help.
So that's a good question. I don't know if one of the three of you know, when we do the point in time count, which is done in January, are those questions asked? So the point in time count is when we do at a point in time, and it's done in January. I don't know if those questions are asked, but I think that raises certainly is a good point.
Well, certainly if folks are not, if they didn't grow up here, investing in Burlington and an Icelandic prevention model wouldn't make a lot of sense. Because that's not a problem. So I agree. I've been thinking that ever since you spoke up. I think it's probably more than 3 questions. There's probably 10. It's a relatively small number of people. I mean, actually, that should not be that hard to do.
No, I think that's an excellent point. Where did you grow up and how long have you,
Yeah, I think my bigger view is that if this is a statewide problem and Burlington just happens to end up, as a home for most of it, it's not going to be solved by Burlington ever. It's going to have to be solved in some of the other communities. And if not, which is probably not, that's why they're here. State's going to have to get involved in a much more substantial way than they are now.
Yeah, I've been thinking about that myself, that whether you're Burlington or Brattleboro or Rutland, any city is going to be a draw for people. If you're a gay person, you're going to be drawn to the city. If you're someone who is of any other, I'm here, okay? Let me just say that. I check a lot of boxes. So there's a definite reason why I live in Burlington. And the same could be said for folks who are homeless and seeking services or seeking community because they are homeless. And maybe you don't have really a great community in, I don't know, Westford, but you have one in Burlington. So I think having more of a municipal, countywide, to your point, let's talk economies of scale. Burlington and in Chittenden County and Winooski and Colchester and Essex and Shelburne and all of our communities in our county, where our people are moving in and out all the time. We live in one place, we work in another place. Burlington should not be shouldering this alone. And we are. So if there is a way to fund it and say, listen, let's have economies of scale as far as the cost of these services, but also shared resources. One thing we also know is true is right now we have a revolving door for folks. If we get them in the treatment, how long are they there for? Is it 12 weeks? That's not long enough. You're kicking someone back to the circumstances that had them in distress in the first place. And people tend to go back to whatever their community may be. And in this circumstance, it may be a community that keeps them into a substance abuse state, not family that maybe could lift them out of it. There are other things that are out of our control that we in Burlington and Vermont had no control over. In the 80s, mental health facilities, boom, gone. And we saw a spike in homelessness, right? We have no control over that. But if we, from a federal standpoint and a state standpoint, start really focusing on how do we build back mental health institutions or mental health hospitals so people can get treatment for more than 12 weeks, let's say 18 months. Drug treatment, again, for 18 months. And when they come out, they have the wraparound services and way to be supported. Right now, we don't have anything in place to support anyone. From a law perspective, I bet y'all are feeling handcuffed by choices that were made down in Montpelier that you have no control over. And it's this holistic approach we're going to have to take a look at, because yes, we can say we're going to be reactive right now to the situation that we're facing, but that's not going to get us out of it. So we can be reactive, and I appreciate exactly what you're trying to do, Chief LaChance, with your CRT units, because we can't have our first responders burnt out. We can't have our healthcare workers in the ER burnt out. We can't have our law enforcement people burnt out. And then we're going to have to work, as you've created your own plan too, Karen, to have these, we're saying short-term, next, and long-term strategic plans. And that's going to mean we need Governor Scott involved, and we're going to need the legislature involved. And we really are going to have to cooperate and coordinate with our surrounding neighbors and towns. And then I'll stop talking. But it is that. It's not going to be easy. But the only way we're going to find ourselves out of it is if we really do dedicate ourselves to some sort of solution. Because I will say this, it's not going away.
Well,
ever since human beings learned to gather, they've been dulling the pain.
And that's something that I know Chief Murad and I see on a daily basis is police and fire services are reactive services. We're
Yes.
not solving the problem, unfortunately, as much as we'd like to. When you call for that person on the park bench and you have this great feeling that I just solved the problem. You did.
That's right.
We went there and we might have solved the acute issue, but it's not solving it long-term for that person. And I agree that we're really good at step one,
Yeah.
right? We're great at step one, but
Yeah.
beyond step one is where we struggle. We just stay in this loop of step one. And it's frustrating for responders, honestly.
Yeah.
Because you just don't feel like you're having enough of an impact.
I think it's about time for us to wrap up, but I wonder if any of our invited guests have any closing words or thoughts that they want to leave us with, besides making sure that we show up on December 13th and 14th. Anything else that any of you would like to share?
Just thank you for having this, because I think people, what I hear from most is that people want to talk about this. They really want to gather and be able to talk about this in a way that is non-confrontational, and just a way of just expressing their concerns for the struggles that we're facing. So if you want to talk about the first step, that's probably the first step, is being able to understand what the challenges are. And then we can find the solution. So thank you for doing this.
And likewise, I want to thank, on behalf of the Ward 6 NPA, I want to thank each of you for showing up and sharing your work and sharing your thoughts, and for all that you do and juggling all the responsibilities that you have. We recognize how much this is to ask, and we really do appreciate it. And I also want to thank community members for showing up, because it does, I think, need to be a community-wide conversation. And I also want to thank Champlain College for hosting us.
Yes, thank you.
And I think we can call this meeting adjourned. Thank you, everybody.
Thank you.
Thank you.
Yeah.